So animals are always managing to somehow get themselves cut and make themselves bleed, so it's important to know how to deal with a wound. A couple things to consider. The first one is, we need to know if it's an arterial laceration or just a vein. So the way you tell the difference between those two is if it's spurting, it's generally an artery, and if it's dripping and you can count, time between the drips, it's usually a vein. So those are just two things to note. First thing to do, when encountering a wound, is just to simply place direct pressure. In this case, I have just some gauze sponges, but if you don't have those available, you can use like a t-shirt or, anything like a diaper or something, just anything to absorb blood. So hold direct pressure on the wound, and what this does is allows the body's natural clotting mechanisms to take effect and stop the clot by itself without having to do any more work. So you do that for about 5 to 10 minutes, and if it stops, then great, your problem solved, and if not, then we need to know what to do next. So also, when you're holding pressure on a wound like this, if the gauze or whatever material you're using becomes soaked with blood, you don't want to remove it off and put a new one on because that can dislodge a blood clot, causing your bleeding to resume. So just remember that, because that's important to hopefully make it stop. So holding pressure, so 5 to 10 minutes, and if that doesn't work, the next step is to actually place a pressure wrap over the top of it. And in my kits, we've got some vet wrap here, and what it does is it really rusty. I didn't get it started. So with our vet wrap, come here, buddy. Come here. Okay. So vet wrap. So you're going to put the pressure wrap right over the top of the wound, and it's okay to do this pretty tight because your whole goal here is to stop the bleeding. We don't want to leave the pressure wrap on for an extended period of time, because if you do, that can actually cause problems in itself, causing swelling and basically causing blood to not reach the bottom part of the limb. So only leave that on as long as necessary to stop the bleeding from occurring. So there's your pressure wrap. The last case, in the worst case scenario, if a pressure wrap doesn't work, is to actually put on a tourniquet. And I shouldn't have to say this, but unfortunately I do. With tourniquets, you want to only use them on distal limbs and not around the neck, because obviously you can see the problem with the tourniquet around the neck, hopefully. So with a tourniquet, I've just put tongue depressors in the first aid kits. If you have a stick or a pin or anything that will work, you can also do that. Mainly this is just to use for leverage. And essentially a tourniquet is, like I said, it's a lever it stops blood flow completely to, everything below the tourniquet. So this will stop the bleeding, but what can happen is if you put a tourniquet on, it should only be used only if necessary, because you can actually lose the limb, because anytime there's not blood supplied to a piece of tissue, it can die. So we want to only use this in extreme circumstances. So to start with a tourniquet, we just take a piece of gauze or a shoelace or anything you might have available. In this case, we'll use gauze, and this is going to be just how you're going to secure it on. And come here, we're Rusty. Come here. My patient's trying to leave here. And so we'll just go like this, and we're going to pretend like our wound is down here, and you'll just make a little tie here, and then tie your lever in between the two pieces. And then what you do is make sure it's secure, and then we'll want to actually twist that. And I'm not going to do it here for him because he's not really bleeding. But you're going to take this and twist the lever just until the bleeding stops happening, and then you'll just secure this on the top with just another piece of gauze or whatever. So make sure you tie a knot so you can periodically release it, like every 5 to 10 minutes, to see if the bleeding has stopped, and also to allow blood to perfuse the bottom portion of the limb. So once again, we just want to clarify that we want to leave these on as little time as necessary. So.